Yeah, we can hear you. Alina is going to be talking now. You should be able to hear her.
All right. So I know y'all are smart. I'm not going to sit here and say this is a stop sign, this is what you should do. We're going to make it a little more fun. Next slide. So why are we talking about this today? We want you guys to stay alive and keep your license once you get it. We want you to just keep in mind you're not the only one on the road. And even if you're doing something right, it doesn't mean others will. So you need to kind of be aware of other people's actions as well as your own. And then we want you to be safe and have low car insurance rates. Whether your parents are paying for it or you're paying for it, the average car insurance rate is about $2,000 without an accident. Once you get in one, it goes up to over $3,500, and that's even without $2,000 of property damage or someone filing a claim against you. Next one. So in Georgia, motor vehicle accidents are the #1 cause of death, but they're also the second in cause of hospitalizations. And we wanted to talk about this because for each death, there's 18 people hospitalized and there are 400 that have medically attended injuries. So they may not have been an inpatient in the hospital, but they went to the hospital or their doctor to get their injuries treated. And this is a really heavy burden on the health system, and taxpayers actually pay a lot of this because all these people are going to the ER with or without health insurance. Okay, next one. So let's go over the basics. So Georgia's #6 in the nation for fatality rates linked to lack of seatbelt usage, which is really high out of all the number of states that we have. And greater than half the teens who died in crashes were because they weren't buckled at the time. And when you use the seatbelt properly, they reduce the risk of fatal injury to front seat passengers by 45% and the risk of moderate to critical injury by 50%. And I have a real life example for why seatbelt is so important. So for speeding, greater than 1/3 of teen motor vehicle accidents involve speeding. And so let's say you're going 20 miles per hour and you slow down to 10, or going 10 and going to 0 because you're stopping. It's the equivalent on your body of being hit from an 8-foot fall from a roof. And then, so on the right, you can see a picture and you can see how much you can visualize when you're driving based on the speed. And you can see also by the speed how likely it is that a passenger hit on the road will have a fatal accident. And then at the bottom, you can see just how long it can take to stop. So let's say you're on the highway, it takes you 21 meters to even realize you need to stop, and then it takes you 75 meters, which is 24 car lengths to actually stop. So when you're tailing someone on the highway, there's no way that if they slam on their brakes that you're not gonna hit them from behind. So here's some examples. A lot of Augusta is about 35 miles an hour. So even then you can get whiplash, concussion, back injuries. And if you get hit going 40 miles an hour, it's about 2 elephants hitting your body. And at 50 miles an hour, you have a 70% risk of injury, which is like a broken bone or, a concussion, and a 52% risk of a serious injury like traumatic brain injury. At 56, you can have severe neck and brain injuries, broken legs, and high risk of facial fracture from it hitting the steering wheel. But just so you know, you can even get whiplash as low as 15 miles an hour, which is like when I'm driving in the parking lot. So just be careful. For aggressive driving, this can count as anything with tailgating, speeding, blocking another car from passing. If they're on your tail and you're trying to show them up or whatever, you can get a ticket for this if a cop catches you, and it can be $5,000 or up to 12 months in prison plus 6 points on your license, which is crazy. So distractions, they're involved in 80% of crashes. Human error is the #1 cause of motor vehicle accidents, and the leading factor in this human error is distractions. 80% of people actually admit to blatantly hazardous behavior while driving, like texting, doing their makeup, eating, shaving, changing their clothes. So don't rely on others to be safe for you. So cell phones is the #1 cause of distractions, and people distracted up to 10% of their driving time. So if you're having a 20-minute drive to school, you spent 2 minutes just looking at your phone, not at the road. And it slows your reaction time to basically that of a grandpa. So don't think that you're actually good at multitasking. It's not true. And then let's say you use talk to text or Bluetooth, talking on the phone. On the right, you can see a picture of when you're not on the phone, how much you can view. And when you're talking on the phone, it narrows down so much. So when those people are jaywalking on Wrightsboro or Walton Way, you're not going to see them coming in until it's too late. You're still 4 times more likely to crash, and your brain's processing about 1/3 less, and your reaction time is 2 times as slow, which is equivalent to a DUI. So music. I listen to music. I'm not saying you shouldn't. The good is that it can impact your mood positively, so you're less likely to get road rage or something like that. But your alertness can be increased if you have a long drive up to Atlanta. But the bad is that if it's really good music and you're jamming out, your concentration can decrease by 40% and your reaction time slows. So you want to do some happy music. You want to listen to like Drake's Tootsie Slide, not Jumpman, and go all out and like get wild, because you're more likely to get a traffic violation. So peers, a teen driver's risk of death per mile driven increases 44% with 1 teen passenger and 300% with 3+ teen passengers. So if you're driving 3 miles, you're doing it 44% times 3. And then teens alter their driving behavior to conform to passengers' attitudes. So this is a good way to subtly influence your peers, because they did a study and they had a stranger come in to be with a teen driver, and one time they were like, "Oh, I'm so sorry, I was just going slow. I was a little nervous this morning." And then afterwards, the teen drove slower and more safely. Or they had another person come in and they're like, "Oh man, I was rushing over here. Sorry I'm late. I sped through some yellow lights." And the teen actually drove way more aggressively, even though it was just a total stranger. So if you act like, you drive slow, and then it can make your friends also drive slow, which is great. And then this picture below is actually something that happened last year on Walton Way, just to reinforce that there were 3 teenagers, I think they were 17 and 2 18-year-olds, and they hit a tree on Walton Way, and all 3 of them died immediately. So it can happen in Augusta as well. Okay, so let's talk about being under the influence. So most likely, most commonly talked about is alcohol. Y'all are going to prom tomorrow. You have no excuse. You have Uber, you have Lyft. Look at the cost of calling an Uber. It's like $6 compared to DUI, jail time. There's absolutely no reason. Call a limo, call your friend, do whatever you need to do to stay off the road once you've had a drink. 29 people a day die in drunk driving accidents, and 8 of them are teenagers. And 5 people a day die from just having a like a little amount to drink. They've been under the legal limit. And then even without deaths, even more people get hurt every day from drunk driving. So becoming more popular, marijuana, as more states are legalizing it. Just so you know, you're still 2 times more likely to crash. And you know how people get, you've seen them on movies, they become real stupid. Okay, imagine them driving, it's on the highway. You're not gonna have good visual acuity, you're not gonna be able to stay in your lane. And let's say you're in one of the states for college that you drive under the influence of marijuana, you can get a $1,000 fine, a year in jail, and 40 hours of community service, and then probation. And just so you know, they tried this out in Colorado where they set a legal limit for marijuana, and it was 5 nanograms, but on the right, you can see this little chart, and the first arrow is after 1 hit, and they're already at like 15 nanograms. So essentially, after 1 hit, you can still go to get a ticket for being over the legal limit. So you just shouldn't do it at all while you're driving. And then just to show that you're not just as fine driving high because you're relaxed. In Colorado, since the legalization, the number of fatalities and crashes with drivers using marijuana have doubled. Okay, so this most likely will apply to y'all. You're very sleepy, you're studying a lot, you have sports. So teens should get how many hours of sleep per night? Think about it. And the actual answer is 9. Okay, so how many teens get this amount of sleep? So they did a study. Think about your answer, like 50%, I don't know, a lot of people are asleep good. It's actually only 10%. So a lot of y'all are not fully alert. If you've been awake for 24 hours, you pulled an all-nighter for your test, you're going to a party on Friday to relax, you've been awake the whole time, it's the same as driving over the legal limit of alcohol. Like, y'all are that impaired. And then drivers 16 to 25, which is your age, cause greater than 50% of all drowsy driving crashes. 1 in 7 people admit to falling asleep at least once. I know y'all have sometimes dozed off or something. Have someone else drive for you. So what's important again? Don't depend on other drivers to be responsible when on the road. You need to do it. Don't drive under the influence. Don't try to multitask. Just wait till you get to school to finish your makeup or eat your breakfast. Don't get road rage. Or don't drive the tank on empty or get a flat tire. Your parents will be pissed. It'll ruin the tire and it'll ruin the car and they may not trust you again. And then don't speed because you're late. Do wear a seatbelt. This is really important to me because I actually got in an accident. I was on the highway and there's traffic and I came to a stop and this big F-150 came behind me at 60 miles an hour. I could see him rolling up and speeding and he was looking down and he crashed in the back of my car. He totaled my car, totaled his car. I got a concussion. If my car had been turned at an angle, it is very likely that I could have died. So it's very serious. It can happen to anyone. This was on I-16. It really is a lifesaver. So for prom, call ride-sharing apps, call a friend, call a parent. That's cool. Just don't drive yourself. Choose soft, happy music. Let your friends reply to your texts for you. Be your co-pilot. Do the GPS. Use your blinkers. I hate when people don't use your blinkers. I'm not a psychic. I don't know what you're thinking. So don't try to pull into my lane without letting me know, okay? Y'all are smart. Don't mess up. You want to go to college. Be a good driver. So now we're going to go into simulation. We're going to show you some pre-recorded scenarios of some patients that are car accident victims. And so when y'all are watching this video, try to think of questions. Stephanie's going to make sure that you each ask a question for every accident victim that you see.
She's on the way.
All doctors in the ER. All doctors in the ER.
What do we got? Hey, we got 4 18-year-olds. Motor vehicle collision suspect. Alright, get the drill, go for the shin, put an IO in.
There's no breath sounds on the right.
Alright, collapse lung on the right, let's get a chest tube.
Code blue, room 305.
Absent pulses. Patient is not breathing. Starting compressions. Code blue.
I'll bag him. Code blue. You're getting clear for oxygen. Tight seal.
I need 2 bores, and we'll switch in 30.
I need a blood gas. Okay, with access. Can I get pads? All right, 2 breaths. Good chest rise. Can I get some pads?
I count on 3.
3, 2, 1.
Hey, can I get a glide scope? On the way, on the way. Do we have
Check.
breath sounds?
No breath sounds.
Do we have a pulse?
Yeah, I got a pulse.
Alright, let's get an airway set up. Start bagging. Can we get a line?
Yeah.
Alright, I'm going for the intubation.
Okay, starting IV access.
Alright, tubes in. Stylet.
Breath sounds bilaterally, none in the abdomen.
Alright, this patient's unstable. Let's get him to the OR.
We have a shock in the window. Get some epi.
Everybody clear space, ready for the shot.
Chest tubes in.
Okay, let's move.
Let's go, let's go.
All right, y'all, we got an 18-year-old male here, Mr. Samuel Jackson. No pertinent medical history, no known drug allergies. He presents for a level 1 trauma, a right anterior tibial fracture.
Alright, Mr. Jackson, we're gonna go ahead and put you to sleep for surgery. Take big deep breaths. This is just oxygen.
Oh, my leg is hurting.
Alright, we're gonna go ahead and push some pain medication for you.
Okay, I'll go ahead and get the fentanyl. All right,
I'm
getting
going
the
to
fentanyl.
die.
Alright, we're pushing fentanyl now. Okay, we're gonna go ahead and push propofol too. You're gonna go to sleep now, Mr. Jackson. Just relax. Okay. Alright, the patient's asleep. I'm gonna go ahead and start the intubation. Patient's intubated. I'm gonna send him to the vent. All right, we're ready for surgery.
Hey there, Dr. Bucci. We got a 18-year-old male, Mr. Samuel Jackson. No pertinent medical history, no known drug allergies. Presents for a level 1 trauma, right anterior tib fracture.
Antibiotics.
Ancep 2 grams.
Okay. Right side to correct side.
Correct side.
Okay, we'll call timeout officially at 11:10 p.m. Okay. Can I have the lights dim, please? Scalpel. Thank you. Scissors.
Bucci, can you stop? Our blood pressure is 85 over 57. Is anything going on down there?
We have some bleeding. I'm trying to control it right now. If you go ahead and push whatever you need to.
All right, Cash, can you give me some blood products and fluids?
Sure, go ahead.
We need to do a
Right on.
massive transfusion protocol.
Fluids and blood products on the way, sir.
All right. We're gonna go ahead and push epi too.
All right, gonna go ahead and give you the epi.
All right, pushing epi. Blood pressure is still 85 over 57.
Okay. Yeah,
We're on our second unit.
trying to control this bleed down here. Go ahead and handle whatever you guys have to do up top.
Pushing more epi. Can we get that third unit of blood?
Sure, right ahead, sir.
Okay. Starting our third unit. Alright, the blood pressure is still dropping. It's now 73 over 51.
Yeah, this bleeding won't stop.
Pushing more epi. Nurse Cash, do we have any more fluids or blood?
I'm trying to control this bleed, fellas. Keep passing over the guards, please. Thank you. What's going on?
All right, we're going into VFib. We may need to shock the patient.
Can we get a
the
defibrillation?
Okay.
Chest compression. All right. I got a pass.
Alright. The defibrillator's ready whenever you are.
Okay, we're ready.
Alright.
Let's shock the patient.
Shock ready.
Stand
Clear.
clear.
How dangerous it can be from making small mistake. So what we did, like we showed you a scenario of different perspective, what can happen in emergency room after trauma, or what can happen in operating room. So what we'll do now, like we will do the live streaming of some of the scenarios that we just showed, and we'll be like going step by step, very slowly, and you are welcome to actually, will strongly encourage you to ask questions. because this is going to be now onwards will be very interactive. The more you get engaged, the more you will enjoy it. Any questions so far? You ready for some action? Okay.
All right, ready to follow?
Let's do.
Yep. All right, so we're going to have, as we go around, okay, so we're going to see the scenarios that we just saw. And I'm going to ask Stephanie, because I see her over there now. I'm going to ask Stephanie to make sure you guys are coming up with a question, okay? We're going to go to each station. I'm going to have these fine doctors kind of explain what is barely. I'm telling Michael to work on it.
If we hear it, then
It'll echo. Yeah.
That's why we can't turn it up. It has to be
Okay. So you guys are going to have to repeat the questions out loud then. Would it be easier to walk around with the
Stephanie,
laptop?
You can also
farther we
enter
get
in the
away.
chat box.
the further we can do that.
Would it be
Yeah.
easier to
So
walk
any
around with the
question
laptop?
if you have, you can enter in the chat.
It would suck.
Yeah. I think typing it out would be the best.
But we can, it'll work.
All right, let's just.
All right,
start.
guys.
Which
so we're
one do
starting
you want
with,
to start? Yes.
Yes.
Okay. So good question, very good question. So what happened, like when the patient starts bleeding, but the bleeding got very profuse and it was not able to control, so then there was not enough blood in the system, and that's why the heart started to stop, and actually it stopped. So that's why we started chest compression. Make sense? Make sense? Okay.
Okay. We have another question.
What type of injury?
This is a.
So it was a motor vehicle accident, and a patient had injury to his leg. And whenever you have accident, there can be other hidden injury. He could have injury to his abdomen or chest that was not recognized. Good? Very good. Okay.
All right. Which scenario are we going to first?
So we go airway breathing circulation. Okay. You all actually come to one station.
All right, guys. So we kind of set this up in a way that you might be familiar with. All right, and that's with the ABCs of CPR, right? We talk about airway, breathing, circulation. I'm sure you guys have heard that all the time. So this particular area, all right, is going to be more about the airway. So I'm going to turn it over to my friend Dr. Lopez over here, and I'm going to ask him to kind of explain his thought process, this terrible accident, unfortunately, that we had to witness. What's going on here, Michael?
Sure. So the first thing in the ED, what we need to do is make sure the patient is stable. And so we follow the mnemonic ABCs. So at this station, we focused on the airway. So you can imagine in a car accident, if you have any trauma to the airway or the front of the chest area, there may be some obstruction. And so what you might have remembered us doing in the video is checking for breath sounds initially. We then checked for a pulse to ensure that there was circulation. And at that point, we knew we needed to secure the airway because, as you guys know, if you go without oxygen, if you can't ventilate your lungs, you'll decompensate very quickly. Within 2 to 10 minutes, you can die, basically. And so what we did was we placed a tube into the windpipe or trachea of this patient. And we did that using a glide scope, which is a video assisted scope that we can use to move the soft tissue out of the patient's front of their mouth and visualize the vocal cords, which is where air goes into the patient's lungs. And once we've done that, we can place this tube in and artificially ventilate the lungs. So I'll try to demonstrate this for you now. So as you can see on the video laryngoscope here, that I'm pushing out the soft tissue and I'm visualizing, and those are the vocal cords there in the front. And what we'll do from there is just go ahead and place this tube through the vocal cords. And actually, right now I'm unable to do it because I don't have a stylet in there, but I'll go ahead and place a stylet. It can be difficult because there's also the esophagus right below the windpipe, which makes it difficult, especially in a trauma situation. But there you can see the tube going through the vocal cords into the windpipe. And once we get it in, we'll remove the blade, and then we can start bag masking the patient and delivering oxygen and removing CO2 from the patient's lungs. And that will help us keep the patient alive until we can get them to surgery, get them stable, get them breathing on their own again. Do you guys have any questions about that? Just any basic questions or any thoughts at all?
You may have to translate for us, Stephanie.
So yeah, so this station is about to show you the importance of airway management. I don't know if we always talk about in medicine or in healthcare that airway breathing.
Yes, we can.
Yeah, so the ambu bag would be preferred over mouth to mouth, but yeah, that's right. So if you were out without any equipment, if you're unable to intubate the patient and get an airway, you could do mouth to mouth resuscitation, which is something they teach in basic life support, just to basically keep air moving, getting oxygen in, getting CO2 out as much as you can, and then you do compressions to keep the blood flowing. You're kind of acting as an artificial heart and lungs for the patient.
And I'm going to add this caveat to you guys, okay? When you're doing compressions, you're actually moving a little bit of air. Because you may not know where your patient has come from, you may not know what kind of disease they have or so forth. The number one thing in all healthcare is that you take care and are safe when you're doing this. So if you don't feel safe giving breaths, then I would recommend that you don't do that, unfortunately, okay? So be very careful. That's obviously in the hospital situation while we have those protective mechanisms that we use.
I mean, possibly you could, but it wouldn't be recommended just because it would be really difficult. I mean, I guess you could, almost use it as a straw, but I've never seen that before, so yeah. I don't think that would be something that would be
done.
And
we do have a plethora of options to ventilate through the tube, right? So we have big ventilator machines, right? Those big ones that you see in the operating room that give big breaths. We have tiny ones that we use in the ICU that give little breaths. We have ones that we use for pediatric situations, and then we have ones that we use in the field that are little kind of mechanically operated, battery-powered ones. So there's definitely different options. We have ones that are we call jet ventilator, which just give a big burst of air, kind of like it came out of an air compressor, and we can use stuff like that. So there's different options, and obviously those are very nuanced, okay? So those are going to be very special situations for that, but there's other options that we can use.
And how much oxygen we have in the air? Like normally we have 21%. And how much oxygen you can give through mouth to mouth? It's even less. That's only 16%. It's not ideal to give mouth to mouth breathing.
All right, I'm going to ask one question to Mary here. I don't know if you guys noticed this down here on this leg. Mary, what is that, and what does that do?
This is a tourniquet, and so a lot of times, if y'all have ever taken any basic life support, if someone on either their arms or legs has a big gash and they're bleeding out, you want to use a tourniquet to apply pressure. And so basically you tie this band around really tight, and then this little rod. Okay. So this little rod is used to twist it and get it even more compressed. And so on a real person, you twist it 3 times,